Pain, not death, is the enemy of mankind. And once you learn about Prudden Myotherapy, you won't have to live in fear of pain. I'm Lori Drummond, certified Prudden Myotherapist, and I'm going to show you how you can get rid of your own back pain. We're going to start with self-help tools. This is a crook, and this will make it easier for you to access trigger points that are a little bit further away. It was designed by myotherapists, so it has nice curves in it to give angles, to give you better access without having you strain, and you can use leverage to do the work for you. We're going to start in the gluteals, which is where most low back pain comes from. These same trigger points will also work for hip pain, sciatica, and actually groin pain. We're going to start in your gluteals, right about where your back hip pocket would be. We're going to look for a triangle right in the bulk of the muscle. It doesn't matter which point you start with, which order you do them in. Put your crook down. Your hand is going to provide a stabilize. The other hand is going to use the small curve and roll it away from you. We're looking for a place that's sensitive. Once you've got that, you have the trigger point. So to diffuse it, we're going to hold that pressure for about 7 seconds. Now to get at these muscles, you want to relax the leg that you're working on. Otherwise, the muscles are too tense to let you in. So find your triangle, pick one point, hold your crook, roll it away from you. Now if you can't find your trigger point, drop the handle and see if that helps. It just changes the angle that you're hitting those fibers on. And sometimes the trigger points are hiding in different fibers of that muscle. Now go ahead and pick your second point, any point, doesn't matter which order you do them. Roll the crook away, keep your weight off of that leg, drop down. These trigger points can also contribute to pain in the legs. And so we've done 1, 2, find your third point. If you're too close to the bone, just put your triangle a little bit closer together. Roll away, change your angle if you need to. And now we're going to look for the outside. So find your hip bone, come just below the hip bone. If you had pants with the seam, it would be right behind the outside seam. Put the crook down behind the seam. Now slide the crook back to hit that bulky part of the muscle. Roll it away. And if you're not finding it, drop the handle down. This angles the point up and often will trap the trigger point against that hip. Slide down a little bit lower for your next point. Put it in place. Slide the crook back. Roll over. You're working like a hydraulic press. So your pressure is nice and steady. And hold that. Now for the low back itself, come on up to your low back. Find your spine. We're not going to press on it, but use it as a guideline. I'm going to be above my hip bone. Find your waist. Come just above the waist, but below your ribs. And if you roll out, you should find a nice little rope-like muscle. Can you see how you can roll back and forth over that edge? Put your crook on the outside edge of that muscle. Roll it away. And if you don't have the trigger point, try changing the angle of the crook. Or round your spine. Push your spine back. If that doesn't work, you can even try tipping into it. These just change the angle that you access the fibers. So there may be trigger points hiding in different fibers that you would find in one position and not the other. These are your most important points in the back, but every back has a front. You need to work on the muscles above the location of the pain, below it, above it, opposite it. So on the front, if you find your hip bone, we're going to find the top of your hip bone, come to the inside of it, and now we're going to use a small curve. Put the crook down. Here's my bone. I'm going to come to the inside, and we're going to press deep. Now pull the crook towards you, and that angles the point up under that ilium, so you're trapping the trigger point. Hold that for about 7 seconds. There's nothing magical about 7, but that's about what it takes to diffuse the points. And slide down about 1 inch. Same thing, press deep. roll it towards you. If you press too close to the bone, you can't get deep enough. So come far enough away from the bone so that you can sink down. Now there's a little ligament that goes between those two bones. It feels like a little piano chord. We're going to be above that inguinal ligament. Your handle is pointing towards the outside of your knee. Press deep, pull it towards you, and that will angle you underneath that inguinal ligament. This gets at one of the muscles that attaches in the low back. So there's your connection between low back pain and the groin. Now, turn your crook over so that the handle points to the outside of your opposite shoulder and go below that little inguinal ligament. Now you're in the thigh. You're going to press deep, and if you lean forward, you can let your body weight do the work. You're angling up under that inguinal ligament, and believe it or not, these trigger points can also contribute to jaw pain because one muscle pulls on the next, pulls on the next. It's a domino effect. These can also contribute to knee pain, groin pain, and menstrual cramps. Okay? These are just a couple of your key trigger points for low back pain. Once you get rid of the trigger points, you want to stretch those muscles to re-educate them so they give up their habit of shortening and going back into spasm. For the groin, you're going to put one foot back, tuck your pelvis under, and nice and easy rock forward. That stretches the groin. Okay. For the low back, you're going to lie down on your side. Bring your top knee up towards your chest. This is the best stretch for your low back. Stretch it out and put it down and relax. Make sure it's relaxed. If it's out straight, it's not relaxed. Top knee up to your chest. Stretch your leg out and put it down and relax. One more time. You want to do these exercises at least 4 repetitions and 4 or 5 times a day because you're breaking a habit. The more often you do it, the better your chances of breaking that habit and reminding that muscle to stay at its resting position. These are just a few of the key points for low back pain. For complete information on Bonnie Prudden Myotherapy, please visit us at our website, bonnieprudden.com, and you'll find a list of the books, DVDs, muscle charts, and our seminars where you can be trained more thoroughly in myotherapy. Thank you for watching, and as Bonnie would say, keep fit, be happy.